The autonomic nervous system has two divisions. The sympathetic, your fight, flight, fright system, innervates much of the body at once, and its effects lasts a little while. Everyone has had a scary experience. When you were scared, your heart rate went up quickly and stayed up for a while. You may have also noticed that you were breathing harder and faster. What you didn't notice is that all your organ systems were changing their activity. The parasympathetic is housekeeping. This division is in control when we are calm. Its effects are short-lived and very localized. We can compare and contrast the autonomic from the somatic. With the somatic, there is one somatic motor neuron to the skeletal muscle cell effector. That motor neuron soma is in the ventral horn of the spinal cord, and its axon would travel on the dorsal or ventral rami to the spinal nerve. The autonomic division is almost always a two motor neuron chain to the smooth or cardiac muscle cell effector. This implies that the two motor neurons must synapse somewhere, and the location of the synapse is called a ganglion. The parasympathetic division functions are noted here. Innervation of these motor neurons decreases blood pressure, heart rate, and respiratory rate. The D activities listed here are hallmarks of parasympathetic innervation as gastrointestinal tract activity is increased. This nervous system also allows for more blood to enter the skin and constricts the pupils. The sympathetic division always has the opposite effects and is activated in times of stress. You can see that it raises blood pressure, heart rate, and respiratory rate while inhibiting gastrointestinal tract activities, dilating pupils, and pulling blood out of the skin. Some organs are controlled by one or the other by default. In other words, they are always under parasympathetic or sympathetic control unless something changes. This is known as tone. The heart and digestive tract are under parasympathetic tone, while blood vessels are under sympathetic tone. A collection of other processes stimulated by the sympathetic division, sweat glands and thermoregulation, changes in blood pressure by the kidneys, metabolic changes in the liver, and activation of the reticular activating system in the reticular functional brain area. We will use this diagram to again compare and contrast. Recall that the somatic system uses one motor neuron to the skeletal muscle effector, where acetylcholine is the neurotransmitter. Let's get some vocabulary out of the way. A ganglion, the structure where the two neurons will synapse. Ganglia are gray matter of the PNS. Preganglionic neuron, the first neuron going from the CNS to the ganglion. Postganglionic neuron, the second neuron going from the ganglion to the effector. In the sympathetic division, the preganglionic neuron is rather short. That's because the ganglion, where the synapse occurs, is close to the central nervous system, off the rami communicantes and the sympathetic chain. That means that the postganglionic neuron will be very long, as it has to travel from just outside the spinal cord to the effector. We also see that acetylcholine is released in the ganglion, but norepinephrine is released onto the effector. In contrast, the parasympathetic division has a long preganglionic neuron because the ganglion is at or near the effector. After the synapse, the postganglionic neuron is very short, but neurons release acetylcholine. There is one exception to the two motor neuron chain. That is the adrenal medulla part of the adrenal gland. This gland sits atop each kidney. With the sympathetic division, one preganglionic neuron reaches the adrenal medulla and stimulates release of epinephrine and norepinephrine to the blood supply. There is no postganglionic neuron in this case. Again, the parasympathetic division shows long preganglionic but short postganglionic neurons because the ganglion is at or near the effector. You can also see that the preganglionic neuron is myelinated. Again, the sympathetic division shows short preganglionic but long postganglionic neurons. This is because the ganglion is close to the central nervous system. We also see that sympathetic preganglionic neurons are branched and myelinated. One last layer of terminology. The sympathetic preganglionic neuron has its soma in the lateral horn of the spinal cord. Those are located in the thoracic and lumbar regions, so we refer to the origin of the preganglionic fiber as thoracolumbar. The parasympathetic preganglionic neuron has its soma in the brain and sacral regions of the spinal cord. Remember cranial nerves 3, 7, 9, and 10. Therefore, we refer to the origin as craniosacral. This diagram is a bit complex, I know, but it does serve a purpose. The sympathetic nervous system innervates almost the entire body at once through several pathways. Imagine a giant web of neurons. That's pretty much what we see here. Some preganglionic neurons will leave the spinal cord, travel on the rami communicantes, enter the sympathetic chain ganglia, and synapse at their level. Others will enter the chain ganglia but travel up or down and synapse at a different level. Lastly, other preganglionic neurons will travel through the chain ganglia and synapse at a collateral ganglion in a different location. These last nerves are referred to as splanchnic. So contemplate the redundancy of this organ system. This is fight, flight, fright. If you don't fight back or run away, you'll die. That's the urgency of the system. So why are there so many pathways? Post your ideas in the A&P Cafe. The parasympathetic system is far simpler. This system is for housekeeping, and there is no physiologic need or reason for redundancy here. Take a few minutes and examine the organs on this diagram. Notice how most organs in the body are innervated by both the sympathetic and parasympathetic divisions. This concept is called dual innervation. It makes sense. If the heart rate goes up when we are scared, then it should go back down when we are calm. There are a few organs that do not exhibit dual innervation. That adrenal medulla we saw earlier, sweat glands, erector pili muscles on hair follicles, kidneys, and most blood vessels. Those organs are sympathetic only. Now that you have the basics of the two divisions, we switch our focus to some odd things about autonomic sensory pathways and neurotransmitters. Your autonomic organs have pain receptors in them. The processes of those pain receptors can often travel on the same pathways, funiculi and tracts, as somatic pain fibers. When these action potentials land in the brain, they can be perceived as being somatic. So what does that mean here? Well, sometimes an autonomic organ hurts, but your brain thinks your skin hurts. The most famous example is the heart attack symptom in males, where they may feel a shooting pain down their left arm. The brain thinks the skin and muscles of the left arm hurt, when in reality, the pain receptors from the heart fire those action potentials. You do not need to memorize this referred pain map, but just explain this concept. And by the way, heart attack symptoms in women are very different. Women may experience backache and nausea, but rarely a painful left arm. Now for neurotransmitters. Recall that neurotransmitters bind some kind of receptor or ligand-gated channel on the postsynaptic membrane. These receptors are also on the effector so that it can respond to the motor neuron. Cholinergic receptors bind acetylcholine, and there are two types. Adrenergic receptors bind norepinephrine, and again, there are two types. Nicotinic receptors are stimulatory cholinergic receptors. We would find these on a skeletal muscle. Muscarinic receptors can be either stimulatory or inhibitory, as there are subtypes. Do you remember the terms IPSP and EPSP? Refresh your memory if you have forgotten your neurophysiology. Stimulatory adrenergic receptors are alpha, while inhibitory are beta, except in our hearts, where beta receptors are stimulatory. Use the free internet to quickly research the heart medications classified as beta blockers. Then answer this question in the A&P Cafe. This is a friendly reminder of the central nervous system structures and which areas control autonomic functions.